Wow, 200 episodes, thousands of hours, millions of lives changed, and we're just getting started. What started as a mission to bring real science and life-saving truth to the public has turned into the #1 health and wellness podcast in the world. I had this dream that we could change the face of humanity, that we could actually shift mankind by putting information out on a platform for free. And today we're celebrating this milestone with a special episode packed with our most jaw-dropping moments.
They made them drink.
Hard-hitting truth bombs.
The majority of the food on our shelves was not created with health in mind. It was created with profits in mind.
And our fan-favorite guest clips.
Like I say all the time, if I break my arm, I'm going to see a doctor. If something's wrong with me health-wise, I'm calling Gary Brecka. I'm getting Gary on the phone.
And by the grace of God, I've gotten to sit with some of my mentors, the people that I've looked up to for decades, the scientists, the PhDs, the MDs, the researchers, the people that are really moving the needle. This episode is a thank you, a celebration of this community, this movement, this mission to make America healthy again. I started this 2 years ago with a dream. I only had one mission in mind. Wow, 200 episodes, thousands of hours, millions of lives changed, and we're just getting started. What started as a mission to bring real science and life-saving truth to the public has turned into the #1 health and wellness podcast in the world, and it's all because of you. I'm Gary Brecka. This is our 200th episode of the Ultimate Human Podcast, and today we're celebrating this milestone with a special episode packed with our most jaw-dropping moments, hard-hitting truth bombs, and our fan-favorite guest clips. And yes, some raw, unfiltered bloopers you've never seen before. If you've been with us since day one or you just joined on this journey, this episode is a thank you, a celebration of this community, this movement, this mission to make America healthy again. Let's take a look back at the moments that made us laugh, made us learn, and level up together. And I'm joined by a very prominent figure in the space, the leader and the head of the MAHA movement, none other than Mr. Bobby Kennedy Jr. himself. Thank you for coming on the podcast.
Gary, I'm happy to be here with you finally.
I'm happy to have you. We've had like a really kind of an amazing time so far, you know, with the hyperbaric chambers, and we basically did some nutritional IVs. And then we just decided to come in the podcast room and chop it up a little bit.
President Trump named me as Secretary of Health and Human Services.
Yes. Congratulations, by the way.
The biggest agency of government. It's twice the size of the Pentagon. It's got a $1.9 trillion budget. And, you know, the irony of that is we spend more on healthcare in this country than any other country in the world per capita, 2 to 3 times what most European countries spend. And yet we have the worst health of any country in the world. We have the highest chronic disease burden on earth. And the etiology ultimately of all that disease is corruption. It was now an agency whose primary focus was maximizing corporate profit taking. First of all, the pharmaceutical companies are advertising products that are being paid for by the taxpayer. Then we're paying for all the diseases that product is causing. Private funding is coming from industry, so they cheat. I mean, we call those guys biostitutes. Because they know what the outcome is and they write the outcome before they write the study. Information is out there, but we also want to respect the intelligence of the American people, you know, the capacity of people who explore the outcomes that are going to benefit them the most. And, you know, I thank you for what you're doing, and we're going to end the war at FDA.
The one and only Mr. Steve Harvey to the Ultimate Human Podcast, brother.
I like that. Of all that other stuff you said.
I was like, the whole podcast is just the introduction.
It's the waiting on the one and only. That's all I tell you, I found out about you on a Thursday. I got you on the phone on a Friday. On Monday, I was sitting in your office. But here's where it started. I had already done a gene test.
Yeah.
I just had never done anything with it.
Yeah.
So
you were
you
not
said,
supplementing for deficiency.
You said I need a gene test, but I didn't know it, but in my medical records, I had it.
Yep.
And then you did my blood work, all this on that Monday.
Yeah. Right.
And you said Thursday, I will have everything you need.
Yep.
And buddy, you did not lie. But what you did was you educated me on myself and my body because I didn't know. The main thing you taught me that I really learned was you said there is no one fix for everybody.
Right.
I've been taking vitamin D pills, and my vitamin D was like a 19?
Yeah, 19.
Low.
It was
Critically
half
low.
the lowest end of the range. Yeah.
What's it now?
69. I looked at 96.
Thank you, Amelia. That's
We
why
got
we
people
have
off
her.
camera.
I didn't even know she was in here.
I didn't see her
that's
hiding behind the
Amelia.
couch there either.
She just popped right up.
69, 96 now. Play it out. We all have it in us. It's just the commitment that you want to make.
Yeah.
But it's an important commitment. You know, come on, man. You got to do something to fix yourself because I want to live a long time.
Right.
Hell, I just got this money. I'm trying to.
You got creative ways to spend it.
Yeah, I got to
too.
start thinking of some stuff.
Exactly.
You know.
Welcome, Dr. Carrie Carda, to the podcast. And, you know, I know that from working with you and seeing you treat so many patients, some of the fixes are relatively simple.
So I think the biggest fallacy that has somehow been created, and I think it came through the traditional model, because I remember how I was taught, was, okay, so 50 to 55 or something like that. But again, it's because you're not flashing anymore, it just means you're sicker.
Yeah.
Yeah. Doesn't mean that you've gotten through it.
It doesn't mean
and it's in your
you don't
rearview
get
mirror.
through menopause. You
That's a
have to
great
fix
point.
it. Even more important than that probably is the fact that if you don't go down that right pathway, you will go down a more dangerous pathway in estrogens. When you have that COMT SNP, that COMT gene, you need to pay special attention to that. You need to make sure you have your nutrients, your B vitamins. You know, we kind of laugh about that time that you were going through, but unfortunately...
You two laugh about that.
Yeah.
Okay. Let's just
But
clarify.
unfortunately, there's
It happens to so many people.
So every day, all day long,
Which is why I
and-
like to talk about it and lay my crazy
Right.
out for everybody, because I know that if I share that story, somebody else is going to raise their hand and go, well, that's
me.
happening to
That's
me
me,
too.
right.
I'm not crazy.
Right.
He doesn't know this, but he is actually a mentor of mine, Dr. Mark Hyman. So
thanks, Gary.
I'm very, very excited to have you on the podcast because you have liberated me from a lot of the chicanery and charlatanry that people accuse me of.
Yeah.
Is that a word or did I just make it?
I think it's a word. Wordish.
Charlatanry. Okay, yeah, let's put that in there. Good. Google it.
My joke is I'm a holistic doctor because I take care of people with a whole list of problems.
Yeah.
You know? And when you get to the root, you don't have to treat each thing separately. We've come together to write a report on the commercial determinants of health. We've heard of the social determinants, which is poverty
Wow.
and lack of access to food and so forth. But the commercial determinants of health are the ways in which multinational corporations, food, ag, tobacco,
Pharma.
alcohol, corporations privatize profits and subvert public health. They're the organization that says that pesticides are safe, that trans fats are good, that smoking tobacco doesn't cause cancer. I mean, I'm not joking here. I was in a movie called Fed Up, which was about childhood obesity with Katie Couric and Lori David. We did about 10 years ago. And I met Bernice King, who's Martin Luther King's daughter. And I said, why don't we show this film at the King Center? I'm like, great.
Yes.
And so a few days later, she called me and said, Mark, we can't show the film. I'm like, why? Because Coca-Cola funds the King Center. The dean of the university said to me, Mark, 50% of the entering class of 18-year-old African-American women have a chronic disease. And when you look at the global burden of disease study, which looked at 195 countries, the number one killer today is not smoking, it's not war, not infections, it's food.
Yeah.
It's 11 million people. And I think that's conservative, probably more. It's like 2 Holocausts a year.
Yeah.
And this is 100% preventable.
Welcome to the podcast.
Thank
Dr.
you,
Rahm.
Gary Brecka. It's an honor to be here. Thank you.
I wonder if you might talk a little bit about your battle with Lyme, how it shaped where you are today, what you did to overcome it. And for people who think they might have one of these conditions, I'd love to go down the rabbit hole of.
Absolutely. Well, first of all, you have a lot of the solutions already, but I can
That's
like
kind of you.
kind of summarize some of them together. But you have a lot of them right here, and that you're talking
Yeah.
about that can really help people. But yeah, that was a challenge for me. I was really young. I say this all the time. I used to be a lot of fun. I was like,
I still think you're fun.
No,
I mean, we
but
had
you
a great
don't-
conversation
no, but
before
I
we
used
came
to
in
be
here.
like really fun. I was in college. I was
I used to be really fun.
it was really fun.
I've never heard somebody self-deprecate like that.
I'm serious.
Yeah,
I
I'm just
lived
a
in
boring old turd. You know?
That's how I feel. It was really tough because, and just for all your listeners, that's when they feel like if someone doesn't believe them when they
Mhm.
have a diagnosis, it's tough.
Oh,
right?
yeah.
I feel like, and I loved talking to you earlier
Mm.
because of your background. Because I review medical data. That's one of the things I've done in my career. And I really think that Lyme disease is a precursor to other things.
Oh, there's no question. Wow.
Dude.
This is a surreal moment.
This is crazy.
Can we just take this in for a second? That we're at the White House and the message is resonating. By the way, welcome back to the Ultimate Human Podcast. I'm your host, human biologist Gary Brecka. This is Max Lugavere.
We must be doing something right to have gotten this incredible opportunity to be here. And I'm so grateful. I mean, for me, it all goes back to my why. I think you always have to remind yourself in these moments why it is that you are doing what you do, and
potentially upend modern medicine in a way that will be catastrophic and catastrophic in a good way. Like just getting back to the basic principles of whole food, movement, exercise, sleep, supplementation for deficiency, that this pandemic of chronic disease was exacerbated by chemicals, synthetics, and pharmaceuticals, not solved by any of those things.
There's now a bounty of evidence mounting showing us that creatine actually also supports cognitive function, mental health.
Right.
But it's unclear at this point how much creatine one needs to take in order for that creatine to be pushed to the brain. It's actually been shown that vegans and omnivores don't differ in terms of their brain creatine saturation.
Oh, wow.
So the dietary levels don't seem to modulate brain levels.
Wow, I would have thought the opposite, actually.
That's what I thought.
Yeah.
That's what I think a lot of people thought.
Yeah, I would have thought the meat eaters would have
exactly
adequate levels of creatine.
Right, because meat eaters ingest it through their diets, right? And vegans obviously don't, because creatine is a carnonutrient. It's found exclusively in animal source foods.
I was actually talking to Bobby Kennedy about this a few months ago. And we were talking about supplementation, modalities, treatments, care options, functional medicine alternatives that provide a benefit, but have very little chance of harm or no downside consequence. And he was saying how the lanes should be more open to things that may or may not work, but actually don't cause harm.
Now, it would be amazing to have had a placebo group. It would be amazing to see if we see significant cognition improvements at lower doses, because 20 grams, again, is a high dose. Anybody who's ever had to suck down, 20 grams of creatine sand.
It is a sand,
Yeah, exactly.
Yeah. Welcome to the podcast, Courtney Swan.
Thank you so much for having me. And
I'm
thank
so
you
excited to have you.
This is so much fun. We were talking earlier on my podcast about how we just felt like little kids. We're just so excited. I was watching all my friends eating Dunkaroos and getting Burger King every night for dinner, and I was upset. And then I was going home to my amazing, organic, home-cooked meals that my mom would be in the kitchen almost for 2 hours every night making everything from
Which
scratch.
you despised her for at the time.
Oh, I despised her at the time.
You're like, what about Lucky Charms, Mom?
Yeah, I was like, I want the McDonald's. I want a Happy Meal. My parents' friends and older generations, and a lot of them still hadn't figured it out. And I was so flabbergasted, for lack of a better word, because I was like, this is so simple, right? It's so simple. The things that we're eating and we're putting in our bodies are either fighting disease or fueling it, you know? And so that really ignited a passion in me. The majority of the food on our shelves was not created with health in mind. It was created with profits in mind.
Today, I'm blessed enough to sit with the father of biohacking, someone who has, unbeknownst to him, been a mentor of mine for many years, followed a lot of his teaching. He really opened my eyes to the entire world of biohacking and longevity and anti-aging and life extension. So welcome to the Ultimate Human, Dave Asprey.
Gary, it was an honor to get to interview you on The Human Upgrade, and an even bigger honor to be on your show. Kudos for just teaching millions of people the stuff that matters.
Thank you so much, man.
Imagine what would happen if you and I picked up everything happening right now. Our little brains that are actually really intelligent but very slow, they'd be overwhelmed. It'd be like you were on a high dose of LSD all the time. Right? It would just, there's so much going on, right? Like, what do I pay attention to?
Right.
So mitochondria, they have to have a decision-making hierarchy. And I figured out what it is because I'm a computer hacker. And I created distributed systems and I troubleshot them for a decade. So if you assume that there's billions of mitochondria, all independently sensing reality, they vote with each other to decide what's real. It's called quorum sensing. And they do this simultaneously with photons, with chemicals, with magnetism, and with quantum coherence.
Wow.
And they go, all right, what's going on? Well, what do mitochondria care about? They care about life. And they run the operating system of all life on the planet, even trees, slime molds, politicians, all of them.
I like how you said slime molds and then politicians.
Was that
on
association?
purpose? Okay.
Depends on the politician, right? So
Slime molds and politicians.
and humans, just to be clear.
That one got me. You got me with that one. Welcome to the podcast, Joe
Thank you.
Rogan, brother.
Pleasure to be here. Thank you.
It's been a long time in the making, man. I'm so pumped to sit down with you today, man.
My pleasure.
Fear factor is being like something you thought would never take off.
Yeah, I did it because
you're like, this is the most ridiculous thing I've ever heard.
I'm like, we're gonna stick dogs on people and make them eat dicks.
Yeah,
like I'm in.
And cockroaches.
All I was thinking, like, this is gonna be great material. I'm gonna have some great material out of this.
I love the show. What finally blew it up? They did some stunt that was like inappropriate, but I forget what it was.
Well, that was the second time we did it. So we did it for 6 years. They made them drink donkey cum. They had to play horseshoes.
The first thing that comes to mind, obviously, is how do you get donkey cum?
Yeah, well, you actually use a cattle prod, and you stick it up, up the donkey's butt, and then you shock their prostate, and they just bust. And then you collect it, and then you get some poor kid who's got credit card debt, and that kid is on Fear Factor to try to pay off his credit card debt generally.
What do you think the it factor is that separates the Joe Rogan podcast from the rest of the media by such a margin?
I don't think about it. Maybe that's what it is.
Maybe that's it. No, maybe that's it, dude. You're like, I'm just going to ask what I want to ask. I'm going to say what I want to say.
Everybody that I put on the show is the only reason they're on the show is because I want to talk to them. That's the only reason. I never say, ooh, that one's going to get a lot of views. Ooh, this one would be controversial. I know people think I think that way, but I genuinely don't.
I hate going down the rabbit hole on social media because it's so unreliable, but there are videos
what are you talking
of
about?
these
the
columns.
Most reliable thing on earth.
Yeah. Oh, this is amazing, dude. Welcome back, Dana White. We got to go do a 3-year anniversary recap.
None of this would be happening had I not finally connected with you 3 years ago.
Thank you, man. That means a lot to me.
That's a fact. It's a fact.
And it really does.
Everybody thinks I'm some paid puppet, and you know.
You're definitely not. You are a paying puppet.
Exactly. Not only am I not paid to do this, I pay to do this.
He paid for an IV today.
But I say it all the time. 3 years ago, Carrie Kasem, a good friend of mine, was terrorizing me to meet Gary. And she's like, he's going to change your life. I didn't want to meet him. I wasn't into this. I didn't believe in any of this. Now I am the complete opposite. If I break my arm, I'm going to see a doctor. If something's wrong with me health-wise, I'm calling Gary Brecka. I'm getting Gary on the phone. Nobody could fix anything that was wrong with me. It was either a new set of pills or a new mask for the CPAP machine and all that bullshit. But none of this would be happening right now if it wasn't for you.
And I'm so deeply appreciative of that. And I want people to hear this message because a lot of what we did was not fancy multi-million-dollar equipment. A lot of it was keto reset diet, getting into a routine, eating whole foods when he came off of a keto diet, basic supplements, methylated multivitamins, trimethylglycine to bring down homocysteine.
I'm telling you right now, this guy can fix everything. He can fix all your problems. He really is a wizard. It's unbelievable. I hope Gary outlives me because I don't want to understand. I don't want to live in a world where I can't call Gary Brecka when I'm fucked up.
I created a monster. For all of my podcasts, I sort of wind down my podcast the same way by asking all of my guests the same question. And I'm really interested in your answer to this. What does it mean to you to be an ultimate human?
I think first and foremost, in the last few years, Gary, I think I've become much more spiritual. Partly, through our own challenges in life. Everyone has unique challenges and we all suffer. That's part of life in different ways. I've lost both my parents in a very short space of time. I've also had a lot of medical persecution. When you put your head above the parapet, you're going to get attacked. And I found a lot of comfort in spirituality. And what I've learned from that is the most important thing, that going back to square one, is that you can't be a healthy person and you can't have a healthy society unless you have healthy values. So how can I be the best possible human I can be? And what does that mean? It means personal growth. It means lifelong learning. It means giving back to the community. And it means making sure I enhance the quality of my relationships with my friends, my family, my so-called partner, whenever that happens. So that for me is my main focus.
To be able to access joy when I want to access safety when I want to access creativity, and to access love whenever I want to. So it's on my terms.
My choice.
And also be a bit badass when I'm driving.
For me, it means being able to get up, put my bare feet on the ground, put the sun in my eyes, hopefully go in the ocean and get some grounding, be in nature and spend time with people I care about in nature, and have the health and the vitality that is necessary to do that. Like being able, for me, the best part of my life is spending time with people I care about in nature. And I need health and I need vitality to do that. Whether we're surfing, whether we're climbing mountains, whether we are snowboarding in the mountains, or whether we are in the ocean, you know, just in a river, like that is being the ultimate human. And like my vitality, my energy, my motivation, my strength comes from having a metabolism that works.
I think try to be the best version of yourself and grow in the right direction every day, physically, spiritually, emotionally. And being a human means we're going to make mistakes. But as long as you learn from those mistakes and keep moving forward, not veer off track, I think you'll be the best human you could be. Hence, ultimate human.
The ultimate human is to be somebody that makes the planet a little bit better, changes people's lives in a little bit of a better way, and give them hope. I think that's critical. I think it's being very responsible for your actions, owning up to it, learning and knowing that you're going to make mistakes, and even telling your kids when they're talking to you that, Daddy, at that age, I was still growing and I'm still growing now. I'm human, right? Yeah. I think it's giving to those who are not in a good place, you know? I think that's just on the holidays. But also testing yourself. You know, too many of us have settled. We're all special.
Yeah.
You got to test yourself. Like, what's a life living without testing yourself? It just, and I think many of us allow society or other people to set goals for us. You set your own goals. Like, how can you live without knowing you didn't try the hard? And it's not easy. And shit will happen.
Yeah.
But to be the ultimate human is to do those things.
If to me, I'm 75 years old and I have all the success and everything, I don't care what I have. If my kids still want to be around me and their kids want to be around me, I am an ultimate human. If I'm able to use my God-given abilities to make anywhere I go a better place, whether it's city, company, country, church, directly or indirect impact, I'm an ultimate human. If I'm able to make my parents proud, whether they're here with me or not, just to be able to amplify the last name, the heritage where I come from, I'm an ultimate human.
Wow.
That's how I view that.
You know, I started this 2 years ago with the dream. I only had one mission in mind: to give without the expectation of receipt. It wasn't to grow an Instagram channel. It wasn't to grow an affiliate link. It wasn't to monetize it. It was to get information that I thought was desperately needed into the hands of the American public. I had this dream that we could change the face of humanity, that we could actually shift mankind by putting information out on a platform for free that could actually be used to practically change lives. The podcast will always be free. The challenges will always be free. The shorts will always be free. And God has been so good to us. We're on our 200th episode, and by the grace of God, I've gotten to sit with some of my mentors, the people that I've looked up to for decades. You know, my mentors are people that are the scientists, the PhDs, the MDs, the researchers, the people that are really moving the needle. It's like if you followed football and Tom Brady walked into your living room and was willing to sit down with you and tell you everything he knew about the game. I mean, this has just been a fascinating journey for me. I prayed for this for a long time, and now it's become a reality. I've got a great team around me. I have a great, loyal fan base of followers like yourselves. So thank you for joining me for this 200th episode. If you love what you've seen on these episodes and you want to take a deeper dive, interact with me personally, you want to go on the ultimate human journey to becoming the best version of yourself, you can sign up to be one of my VIPs. Just go over to theultimatehuman.com/VIP and join me in our VIP group. And until next time, that's just science.